You know that feeling when you stand up after sitting for a while and your legs feel heavy, almost like they're not quite ready to move. Or maybe you've noticed that your feet seem colder than they used to be, even when you're wearing warm socks. Perhaps you found yourself needing to pause more often during your daily walk, not because you're out of breath, but because your legs just feel tired. These aren't just random inconveniences that come with getting older. They're often signs that your circulation isn't working quite as efficiently as it once did. And here's what's genuinely hopeful about this. While we can't turn back the clock, we absolutely can improve how well blood flows through our legs through specific, targeted exercises that work with our body's natural mechanisms. The difference between legs that feel heavy and sluggish versus legs that feel energized and capable often comes down to how well we're supporting the systems that move blood back up from our feet to our heart. This isn't about becoming an athlete or spending hours at a gym. It's about understanding 5 specific movements that researchers and vascular specialists have identified as particularly effective for improving lower leg circulation in adults over 60. What makes these exercises special isn't that they're secret or complicated. It's that each one activates specific physiological mechanisms that directly enhance blood flow, strengthen the vessels themselves, and support the muscle pumps that help push blood against gravity. When older adults incorporate these movements consistently, many notice that their legs feel lighter, their endurance improves, and those uncomfortable sensations of heaviness or restlessness decrease. I'm going to share these 5 exercises with you in countdown fashion, starting with number 5 and building toward the most effective one based on research evidence. Each of these has been studied and documented in medical literature, and each works in a slightly different but complementary way to support healthy circulation in your lower legs. Before we dive in, I'd love to hear from you. Would you comment below with your age and where you're watching from, whether that's your city or your country? I genuinely read these comments because they help me understand what topics matter most to people in our community and what kinds of challenges you're facing. It really does help create a supportive space where we're all learning together. Now, let me give you some context about why circulation tends to become less efficient as we age and why these specific exercises make such a difference. As we get older, several things happen in our vascular system. The walls of our veins can lose some of their elasticity, making it harder for them to efficiently push blood back toward the heart. The tiny valves inside our leg veins, which are supposed to prevent blood from flowing backward, can become less effective over time. Additionally, if we become less active, the muscles in our calves, which act as a kind of pump squeezing blood upward, may have weakened. This combination means that blood can start to pool in the lower legs rather than circulating efficiently. The good news is that targeted movement can address each of these factors. When we activate our leg muscles in specific ways, we're essentially assisting our circulatory system, helping it do its job more effectively. The exercises I'm about to share work because they either strengthen that crucial calf muscle pump, encourage the vessels to maintain their tone and flexibility, or simply get blood moving when gravity and weakened valves are working against efficient flow. Before we begin, I want to be clear that this information is educational and doesn't replace professional medical advice. If you have existing health conditions, particularly anything related to your circulation like peripheral artery disease, a history of blood clots, or chronic venous insufficiency, please talk with your healthcare provider before starting any new exercise routine. These exercises support healthy circulation, but serious circulatory problems need proper medical diagnosis and treatment. These movements complement medical care rather than replacing it. Let's start with exercise number 5, which is ankle pumps, sometimes called ankle flexion and extension. This might seem almost too simple to be effective, but there's solid research behind why this movement matters for circulation. A study published in the Journal of Vascular Surgery examined various exercises for preventing blood pooling in the legs and found that even simple ankle movements significantly increased venous blood flow velocity. Here's why this works from a physiological standpoint. When you flex your foot upward, bringing your toes toward your shin, you're activating the muscles along the front of your lower leg. When you point your toes downward, you're engaging your calf muscles. This alternating contraction and relaxation creates a pumping action that literally squeezes blood upward through your veins. It's particularly effective because the muscles you're activating are wrapped right around the deep veins in your lower legs, so the compression is direct and efficient. To perform ankle pumps correctly, you can do them while sitting in a chair or lying down, which makes them accessible even if you have mobility limitations. Start by sitting comfortably with your feet flat on the floor. Lift one foot slightly off the ground, just a few inches. Now slowly pull your toes back toward your shin as far as comfortably possible. Hold that position for about 2 seconds. Then point your toes downward and hold for another 2 seconds. That's one repetition. The key is to move through the full range of motion your ankle allows, and to do the movement slowly and deliberately rather than quickly pumping. Aim for 15 to 20 repetitions with each foot, and try to do this 3 to 4 times throughout your day. You can do ankle pumps while watching television, reading, or even sitting at your desk. If you have limited ankle mobility due to arthritis or previous injuries, just move through whatever range feels comfortable without forcing anything. Even small movements create some pumping action. The beauty of this exercise is that it's nearly impossible to do wrong and has virtually no risk. Many people notice that if they do ankle pumps regularly, especially after periods of sitting, their legs feel less stiff when they stand up. Some find it helpful to do a set before getting out of bed in the morning to get circulation moving before putting weight on their legs. This is also an excellent exercise to do during long car trips or flights, where prolonged sitting can really slow down circulation. Moving to exercise number 4, we have seated marching, which elevates the intensity just slightly while still being doable for most people. Research from the American Heart Association's Guidelines on Physical Activity for Older Adults specifically mentions that rhythmic leg movements while seated provide cardiovascular benefits and improve venous return from the lower extremities. Seated marching works because it combines several beneficial actions at once. You're activating your hip flexors, quadriceps, and to some extent your calf muscles. You're also creating movement at multiple joints, which means you're compressing veins at various points along your leg, not just at the ankle. This multi-level compression helps move blood more effectively than single joint movements alone. To do seated marching properly, sit toward the front of a sturdy chair so you have room to move. Your back should be relatively straight but not rigidly so. Keep your feet flat on the floor to start. Now lift your right knee upward as if you're taking a step, bringing your thigh up as high as comfortably possible while keeping your back straight. Lower that foot back down with control, then immediately lift your left knee the same way. Continue alternating in a smooth, rhythmic pattern, almost like you're walking in place while seated. The pace should be moderate, not rushed. Think of it as a purposeful walking rhythm rather than a race. Breathe normally throughout and don't hold your breath. Start with 1 minute of continuous marching and gradually work up to 3 to 5 minutes as it becomes easier. Try to incorporate this 2 or 3 times daily. If lifting your knees high is challenging, you can modify this by doing smaller lifts, raising your heels off the ground while keeping your toes down, or even just pressing one foot down while lifting the other slightly in an alternating pattern. The goal is rhythmic alternating leg movement, and any version of that provides benefit. What makes seated marching particularly valuable is that it gets your heart rate up slightly, which means your heart is pumping more blood through your system overall, and it does this while being very safe and controlled. Studies on older adults have shown that regular seated exercises that elevate heart rate modestly can improve overall cardiovascular function over time. You might notice after doing this regularly that you have better stamina for standing activities and that your legs feel more responsive throughout the day. Exercise number 3 brings us to calf raises, which engage what vascular specialists often call the peripheral heart. Your calf muscles, particularly the gastrocnemius and soleus, play such a critical role in circulation that they've earned this nickname. Research published in the European Journal of Preventive Cardiology has demonstrated that strengthening exercises for the calf muscles significantly improve venous pumping efficiency in older adults. The mechanism here is straightforward but powerful. When you rise up onto your toes, your calf muscles contract forcefully, and because these muscles surround the deep veins in your lower leg, that contraction squeezes those veins and forces blood upward toward your heart. When you lower back down, the muscles relax and fresh blood flows into the area. This repeated squeeze and release is exactly what your body needs to overcome the challenge of moving blood upward against gravity. To perform calf raises safely and effectively, stand near a counter, sturdy table, or the back of a solid chair that you can hold onto for balance. Position your feet about hip-width apart with your weight distributed evenly. Keeping your legs straight but not locked at the knees, slowly rise up onto the balls of your feet, lifting your heels as high as you comfortably can. Hold that top position for 2 to 3 seconds, really focusing on squeezing your calf muscles, then slowly lower your heels back down until they touch the floor. The lowering phase is just as important as the lifting phase, so don't just drop down quickly. Each complete repetition should take about 5 to 6 seconds total. Start with 10 repetitions and work your way up to 15 or 20 as you build strength. You can do this exercise once or twice daily. If you find that rising up on both feet is too challenging, you can modify by keeping one hand on a counter for more support, or by doing smaller raises where your heels don't lift as high. As you get stronger, you can progress by holding the top position longer or by trying single leg calf raises, though this is an advanced variation that requires good balance. The Cleveland Clinic's recommendations for improving leg circulation specifically mention calf raises as a foundational exercise because the calf muscle pump is so central to venous return. Many people find that after several weeks of consistent calf raises, they notice improved endurance when walking, less achiness in their legs at the end of the day, and sometimes even a reduction in mild swelling around the ankles that can occur when circulation is sluggish. One important safety note: if you have any balance issues or feel unsteady, make sure you're holding onto something very secure, and consider having someone with you the first few times you try this exercise. If you're finding this information helpful and you'd like to stay updated with more evidence-based health content designed specifically for your needs, I'd really appreciate if you'd subscribe to the channel. It helps you not miss future videos that might address other concerns you have about staying healthy and active. Now we're getting to exercise number 2, which is walking. But I'm going to explain why walking deserves this high position on our list and how to approach it specifically for circulation benefits. You might think walking is too obvious to mention, but research consistently shows it's one of the most effective activities for improving lower extremity circulation in older adults. A comprehensive study from Harvard Medical School followed adults over 60 and found that those who walked regularly showed measurable improvements in arterial function and reduced arterial stiffness compared to those who remained sedentary. Walking works for circulation in multiple ways simultaneously. First, the rhythmic contraction of all your leg muscles, from your hips down through your calves, creates powerful pumping action that moves blood through both veins and arteries. Second, walking increases your heart rate, which means your heart pumps more blood volume through your entire circulatory system. Third, regular walking has been shown to improve endothelial function, which is the ability of your blood vessel walls to dilate and contract appropriately. The endothelium is the inner lining of your blood vessels, and when it functions well, your vessels can adjust their diameter to regulate blood flow more effectively. Fourth, walking helps reduce inflammation in blood vessel walls, which supports overall vascular health. The key to walking for circulation improvement is consistency and gradual progression rather than intensity. You don't need to walk fast or far, especially when you're starting out. What matters is regular movement. Begin where you are currently comfortable. If that's 5 minutes around your home or yard, that's a perfect starting point. The goal is to walk most days of the week, ideally 5 to 7 days, and to very gradually increase your duration as it becomes easier. Research suggests that working up to 20 to 30 minutes of continuous walking provides optimal circulatory benefits, but building to that point might take weeks or even months, and that's completely fine. Focus on a comfortable pace where you can still hold a conversation. If you're breathing so hard that you can't talk, you're pushing too hard for the purpose of supporting circulation. During your walk, pay attention to how your legs feel. Some mild muscle fatigue is normal and actually beneficial, but sharp pain, severe cramping, or pain that stops you from walking and then goes away with rest could indicate a circulation problem that needs medical evaluation. Don't ignore those symptoms. If you have balance concerns or live in an area where outdoor walking isn't practical, walking indoors works just as well for circulation. You can walk around your home, through a shopping mall, or use a treadmill if you have access to one. The surface and location don't matter nearly as much as the regular rhythmic movement. For those with significant mobility limitations, even walking in place while holding onto a counter, taking small steps forward and back in your kitchen, or walking short distances multiple times throughout the day all provide benefit. One modification that can be particularly helpful is to include some gentle elevation if you're able. Walking up a very slight incline, even just the gentle slope of a driveway, requires your leg muscles to work a bit harder, which can enhance the pumping effect. However, don't attempt hills or significant inclines if they cause pain or feel unsafe. The Mayo Clinic's guidance on exercise for vascular health emphasizes that the relationship between walking and circulation improvement is well established across numerous studies, and that the benefits accumulate over time. People who walk regularly often notice within a few weeks that they can walk farther before their legs feel tired, that any swelling they experience is reduced, and that their overall leg comfort improves. Some also notice secondary benefits like better sleep and improved mood, which makes sense given that walking supports overall cardiovascular health, not just leg circulation specifically. Finally, we've arrived at exercise number 1, the most effective movement for improving leg circulation based on the research evidence, and that is leg elevation combined with ankle exercises. This might surprise you because it's not a traditional exercise in the sense of something that builds strength or endurance, but its impact on circulation is profound and immediate. Studies in the Journal of Vascular Surgery and Research from Johns Hopkins have demonstrated that elevating the legs above heart level dramatically increases venous return and reduces venous pressure in the lower extremities. When combined with movement, the effects are even more pronounced. Here's the physiological explanation for why this works so well. When your legs are elevated above the level of your heart, gravity finally works with your circulatory system instead of against it. Blood that has been pooling in your lower legs can flow more easily back toward your heart. The pressure inside your leg veins decreases significantly, which gives those veins a chance to recover if they've been stretched or stressed from prolonged standing or sitting. The valves inside your veins, which may be struggling to prevent backward flow when your legs are down, get a break. When you add ankle movements while your legs are elevated, you're combining this gravitational advantage with active muscle pumping, creating an optimal environment for circulation. To practice leg elevation with ankle exercises properly, you'll want to lie down on your back on a comfortable surface like your bed or a carpeted floor. Place 2 or 3 pillows under your lower legs and feet so that your feet are elevated higher than your hips, and ideally your knees are slightly bent rather than locked straight. You should feel comfortable and relaxed in this position, not straining. Once you're positioned comfortably, begin doing the ankle pumps we discussed earlier, slowly flexing your feet up and down, pointing and flexing. Do these movements gently and rhythmically for about 1 to 2 minutes. Then you can add some ankle circles, rotating your feet in slow circles in one direction for about 30 seconds, then reversing direction for another 30 seconds. You can also try spreading your toes apart and then curling them, or wiggling your feet from side to side. The goal is gentle, varied movement while maintaining the elevated position. Stay in this position for 10 to 15 minutes total. You can do this once or twice daily, and many people find it particularly beneficial in the evening to help reduce any swelling or heaviness that has accumulated during the day. If lying flat is uncomfortable for you due to back issues or breathing difficulties, you can modify this by reclining in a chair that allows you to elevate your legs on an ottoman or stack of pillows, as long as your feet are elevated above hip level. Even sitting with your legs up on a couch while leaning back against cushions provides some benefit. What makes this exercise number 1 is the combination of how effective it is, how safe it is for nearly everyone, and how quickly people notice results. Many individuals report that their legs feel noticeably lighter and more comfortable even after the first session. Research on chronic venous insufficiency, a condition where circulation is significantly impaired, shows that regular leg elevation is one of the most effective conservative treatments recommended by vascular specialists. While you're in this elevated position, you're giving your circulatory system a chance to clear out metabolic waste products that may have accumulated, bringing fresh oxygenated blood to your leg tissues and reducing strain on your vein walls and valves. Over time, regular practice of leg elevation can help prevent the progression of circulation problems and may reduce symptoms like restless legs, nighttime leg cramps, and ankle swelling. The only contraindication is if you have certain heart conditions where elevating your legs causes fluid to shift in a way that makes breathing more difficult, but your doctor would have told you if this applies to you. For the vast majority of people over 60, this is an extremely safe and beneficial practice. So those are your 5 exercises, presented from number 5 up to number 1. Ankle pumps for accessible, anytime circulation support. Seated marching for rhythmic multi-joint activation. Calf raises to strengthen your peripheral heart. Walking for comprehensive vascular benefits, and leg elevation with ankle movements for maximum circulatory support. What I want you to take away from this isn't that you need to do all 5 exercises perfectly every single day. Instead, think about how you can gradually incorporate these movements into your regular routine in a way that feels sustainable. Maybe you start with just the leg elevation in the evening and ankle pumps during the day. Maybe walking is already part of your routine, and you can add in calf raises a few times a week. The research shows that consistency over time matters much more than perfection on any given day. Your circulation will respond to regular movement and regular support. Most studies indicate that people begin noticing subjective improvements, meaning how their legs feel, within about 2 to 4 weeks of consistent practice. More objective measurements like improved venous flow velocity or reduced swelling often show up around the 6 to 8 week mark. This isn't overnight magic, but it's also not years of waiting. It's the kind of time frame where your commitment and consistency genuinely pay off. Remember that these exercises support your circulation and complement whatever medical care you're receiving, but they don't replace medical evaluation if you're experiencing significant symptoms. If you have pain in your legs that stops you from walking and goes away with rest, if you have persistent swelling, if one leg is noticeably more swollen than the other, if you have skin changes or wounds on your lower legs that aren't healing, these warrant a conversation with your healthcare provider because they could indicate conditions that need medical treatment. These exercises are wonderful for supporting healthy circulation and addressing the normal age-related changes we all experience, but they're not a substitute for diagnosis and treatment of vascular disease. I'm genuinely curious about your experience. Have you noticed changes in your leg circulation as you've gotten older? Are you already doing any of these exercises? Which one are you most interested in trying? Let me know in the comments because I really do read them, and your feedback helps me understand what topics would be most valuable to cover in future videos. If there are other aspects of healthy aging you'd like me to address with the same evidence-based approach, mention those too. Thank you for taking the time to invest in your health by watching this video. The fact that you're here, learning and looking for ways to support your well-being, shows real commitment to staying active and healthy, and that deserves recognition. Take care of yourself, and I'll see you in the next video.